How would you like to work in a profession that makes a difference? One that's really at the forefront of disease prevention. A profession that encourages you to develop your investigative skills to solve problems in the workplace that have a real impact on people's lives. Hi, I'm Dan Clark. My firm specializes in making work environments safe by helping others solve occupational health related problems. One of the ways that we do that is by offering professional development courses and certification programs. I encourage you to visit clarkconsultants.ca to see what courses we offer. So I call this video, Do You Want to Be an Occupational Hygienist? It's a subject that's very dear to my heart and I'm very excited about because it's a profession that's at the forefront of saving workers' lives. Yes, I know what you're thinking. How can a profession that nobody's ever heard of be at the forefront of anything? What is an occupational hygienist and why would I want to be one? Well, I'll try and answer those questions. Occupational hygienists focus on the health part of occupational health and safety. We are the folks that are out there looking at stuff in the work environment that can cause workplace illness and disease. And it's our job to figure out ways of preventing it. Sometimes we work backwards. For instance, a person has some symptoms or a disease, and then we try to figure out what chemical agents could be causing it. It's kind of like that CSI TV show. Only our victims usually have been murdered. They're just regular folks trying to earn a living. And yes, you do have to have some science and engineering knowledge to find out the answer. To give you an example, I remember one case where we had a bunch of refinery workers that had developed rashes on their groin. One might guess that this was related to contact with others who had some type of infection. But while these workers did part together, the problem did not arise out of social interaction. It was the result of dry cleaning fluid, a substance called perchloroethylene. The substance was used to clean their coveralls and a small bit remained in the material. Add this information plus the fact that they did not like to wear underwear in the summer, and we guessed that we had a chemical exposure problem, not a biological infection. So what we did is we switched to normal washing in soap and water rather than dry cleaning, and the problems went away, resulting in happy workers and even happier spouses. More often we work kind of the other way around, because we know that some things like noise or asbestos or benzene and radiation can cause disease. We work to identify environments where these agents could occur. Then we act to prevent exposures before they can cause disease. Sometimes this means measuring airborne exposure levels to contaminants, and sometimes this means control measures should be recommended, like ventilation or respiratory protective equipment. The aim is always to keep exposures to things that cause disease as low as possible. Another question people might ask is, why should I care about occupational disease prevention at all? Don't more people die because of workplace accidents? That's what most people think, but it's not true, and it's not true by a long shot. In 2010, Alberta Health Services estimated that 761 of the 5,700 cancers they had in the province are work-related. Basically, it's the number one cause of preventable cancer after smoking. Yet the WCB only recorded 74 work-related accident fatalities in the same year. The sad fact is that most workplaces don't know that they have potential occupational disease problems. That's why we need some more occupational hygienists. Some employers are starting to understand the need, so if you decide to get into the profession, you won't have much problem finding work. I've never heard of an occupational hygienist that's unemployed that did not want to be. Instead, your problem will be trying to figure out which problem to fix first and for which employer. So if you want to make a big difference and save some lives, become an occupational hygienist. If you want to find out how, please visit our website, clarkconsultants.ca, to learn about a great new training program in occupational hygiene that leads to international certification. Or watch my other video called How to Become Certified in Occupational Hygiene. If you found this video helpful, please hit the like button down below or send us an email. If you have any questions or comments, email us at info@clarkconsultants.ca. Thanks for watching.